This program definitely sets you up for success.
No matter where you live, no matter where you're going to work, there's something to be said about being a Gator OT.
This program really equips us with the knowledge and skills that we need to be an entry-level occupational therapist.
The Doctor of Occupational Therapy program was designed to train students to be what we call clinician scholars. These are graduates of our program who are able to find evidence, understand the evidence, and use the evidence to make clinical decisions that are going to be the best for their patients and clients and their families. What really sets us apart from other programs is the fact that we're embedded in an academic health center. We are part of the College of Public Health and Health Professions, but we also have this really unique opportunity to be with 5 other health center colleges. That means our students are getting the benefit from all of the different training and research that's going on in multiple different areas.
My first exposure with occupational therapy was actually an undergrad from a friend who was applying to occupational therapy programs. I did some research,
Using my blue markers.
and I also took some opportunities to shadow and volunteer. And I really enjoyed how creative it was and also how tied in with health it is. So I really like that mix of creativity and health.
This is your river, and there are no rules.
We use a lot of really innovative teaching strategies. Lots of active learning, hands-on. We do a lot of group discussion and projects. The capstone allows them to specialize. They might decide that they want to learn more about a specialty clinical practice area or an area of community practice, or even a special area like management or leadership or education. Our teaching assistants and our adjunct co-instructors are actually occupational therapists who we hire to come in and work with our students along with our clinical faculty, and getting all of that expertise all in one room is really special for our students.
My favorite part of the program is obviously learning all the objectives, the anatomy, the neuro, the biomechanics, and applying it. And then field work is just the whole cake because you get to take everything your teachers taught you and apply it in real life scenarios.
The advice that I would give to myself before starting the OT program, if I could go back in time, would be to really make the most of my learning experience here at UF, whether that's being involved in clubs, organizations, or getting to know my peers more, or getting to know my professors more, really building those connections, because the connections we make in the program also build this community of future and current clinicians, and I think that's really important for growth and just for knowing that you're not alone in this journey.